Ready for an eye-opening video about eggs that might change how you cook breakfast forever? I am a physician with over 20 years of clinical practice and nutrition counseling, and today I will show you practices with eggs that are actually harmful and how to fix them simply and safely. How should you really cook an egg so you do not destroy nutrients? Is undercooked yolk a real risk for salmonella? Does frying in butter make eggs unhealthy? Can you store eggs at room temperature or do they belong in the fridge? Is it safe to eat raw eggs in smoothies? And how many eggs per day are okay for most people? I will answer these questions and reveal 7 science-backed findings that will surprise you and protect your health. If you are not subscribed yet, join our community so you do not miss clear, practical guidance. Now, let us go to the first block, where I explain what not to do and why you should never eat eggs certain ways. Next, I will outline what we will cover and why the evidence matters. First, I will list 7 key revelations from clinical research and guidelines, each one with a simple how-to-fix tip you can use today. Then, I will answer the most common questions I get from patients and viewers with direct, practical steps for cooking, storing, and pairing eggs to maximize nutrition and minimize risk. This content is based on studies from reputable journals and recommendations from the American Heart Association and food safety authorities, explained without medical jargon. Stay with me through the Q&A because halfway through I will ask you a quick question in the comments that helps shape future videos. Ready? Let us start with 7 reality checks about eggs that everyone should know. 1. Never eat eggs that are runny on the surface and raw inside if you are in a high-risk group. The risk is not huge for healthy adults, but for infants, pregnant people, older adults, and immunosuppressed patients, it can be serious. Studies in food safety journals remind us that proper heating reduces salmonella risk. Practical fix. Cook until the white is firm and the yolk starts to thicken. Imagine cutting into a soft-boiled egg and feeling a gentle steam rise, smelling a faint sulfur sweetness, seeing the white fully set while the yolk is glossy but not liquid. I recently explained this to Maria, a new mother, and she said she could feel the texture change when I described it. Maria, is that still tasty? Yes, you get creaminess without risk. Maria, how long do I boil? Around 7 minutes for a medium egg at sea level. Maria, and stored how long? Up to a week refrigerated in the original carton. That quick exchange helped her feel confident and safe. 2. Never fry eggs in excessive processed oils or old oil that smells rancid. High heat and reused oil create oxidation products that can affect flavor and possibly health. Choose a small amount of olive oil or butter and listen to the pan sizzle. Notice the golden edges and the light nutty smell when it is right. Dr. Lee, a cardiologist I spoke with, said that the type of fat you use matters for long-term heart risk. Dr. Lee, so olive oil is better than margarine? Yes, when used moderately, it keeps antioxidants intact. Dr. Lee, what about ghee? Ghee is stable and gives a pleasant aroma, but still use sparingly. 3. Never habitually discard the yolk thinking you are automatically cutting cholesterol risk. The yolk contains choline, vitamin D, B12, and lutein, nutrients linked to brain and eye health. The American Journal of Clinical Nutrition and other studies show that for most healthy people, eating whole eggs in moderation does not raise heart disease risk significantly. Imagine the yolk as a small golden sphere, slightly slick to the touch, with a rich flavor that adds satisfaction. When I explained this to Sophia, a registered nutritionist, she smiled and offered a recipe for pairing eggs with leafy greens to balance fats and fiber. Sophia, combine eggs with spinach to boost lutein absorption. Exactly, the fat in the yolk helps absorb fat-soluble vitamins. 4. Never store eggs at room temperature for days if your local food system recommends refrigeration. In many countries, eggs are washed and need refrigeration. In others, they keep a protective coating and can be stored at room temperature briefly. When you open a carton in the market, feel the cold, notice condensation on the box if refrigerated, and check dates. Mark, a chef friend, taught me to buy smaller amounts and keep eggs toward the back of the fridge where it is coldest. Mark, always keep eggs in their carton.
Yes, the carton protects from odors and temperature swings. 5. Never mix raw egg in smoothies for children or vulnerable people without pasteurization. Raw eggs can spread bacteria, and pasteurized egg products are a safer alternative. I recall John, an athlete, asking if raw egg whites in protein shakes helped muscle building. John, are raw whites better for gains? Not necessary. Cook or use pasteurized products, and you will still get protein for muscle repair. Does cooking reduce amino acids? No, protein remains highly available when gently cooked. 6. Never assume brown shells mean more nutrients. Shell color is determined by breed and not by nutrition. What matters is hen diet and freshness. When shopping, look for labels about omega-3 enrichment or pasture-raised if that matters to you, and notice the weight and sound when you gently shake an egg. A faint slosh can indicate aging. 7. Never ignore how you pair eggs with the rest of your meal. Pairing with fiber-rich vegetables and whole grains reduces glycemic impact and increases satiety. The scent of toasted whole grain bread, the crunch of fresh lettuce,
the warmth of the plate combine to make a balanced meal. Studies from clinical nutrition show that eggs at breakfast increase satiety and may reduce total calorie intake later in the day. Now we go to the Q&A section where I answer specific questions I hear every week. I will be direct, evidence-based, and practical, and I will include little dialogues from clinic moments so you hear how I talk to patients. Question 1. How many eggs can a healthy adult eat per day safely? Answer: based on multiple studies and guidance from the American Heart Association, is that 1 to 3 eggs per day is acceptable for most healthy people as part of an overall healthy diet. For individuals with familial hypercholesterolemia or specific lipid disorders, we adjust recommendations. Lucy, a patient, asked recently, "Lucy, I have high LDL, what then?" We personalize the plan and focus on overall saturated fat intake and medication if needed. Lucy, so eggs in moderation are okay? Yes, but monitor lipids with your doctor. Question 2. Is raw egg and shake safe? Answer: no, for at-risk groups, use pasteurized eggs. Question 3. Does frying always make eggs unhealthy? Answer: not necessarily, if you use stable fats and modest amounts and avoid deep frying in reused oil. Question 4. Does poaching keep more nutrients? Answer: poaching and boiling are both gentle and preserve nutrients well, while keeping the white firm. Question 5. Can eggs raise my cholesterol dangerously? Answer: dietary cholesterol has less impact on blood cholesterol for most people than saturated fat does, according to several studies. Question 6. How to safely reheat leftover scrambled eggs? Answer: reheat quickly to steaming hot and avoid long holding times. Smell and texture cues help detect spoilage. Question 7. Are egg whites enough for athletes? Answer: whole eggs give additional nutrients like choline, important for recovery and brain health, so many athletes benefit from whole eggs. Question 8. What about allergy concerns? Answer: egg allergy is common in children and requires avoidance and guidance from an allergist. Emma, a pediatric nurse I know, emphasizes careful label reading for processed foods. Question 9. How long can eggs stay in the fridge? Answer: generally up to 1 week after opening the carton, but check local guidance. When in doubt, do a sniff test and a visual check. Question 10. Is it okay to eat eggs every day? Answer: for most healthy adults, moderate daily consumption is fine, but always consider your overall diet and cardiovascular risk profile. Now a quick pause and an invitation to you. If you have been confused by online advice about eggs, you are not alone. Write in the comments below, starting with the word breakfast if you usually eat eggs in the morning, or write dinner if you prefer eggs at night. Tell me if you cook them runny or fully set, and what oil you use. Your short reply helps me decide which recipes and demos
to film next and helps other viewers see practical variations. If many of you write breakfast, I will make a video with 5 egg-based breakfasts that are quick and safe for busy mornings. Thank you for sharing the real-life practice you use. If you like the practical tips so far, please tap like and share this video with a friend who still thinks frying in old oil is fine. A like helps the channel and lets me keep making clear, evidence-based content and quick demonstrations you can trust. As an extra note, I will tease a related topic you should not miss. In an upcoming video, I analyze how poor protein timing and low vitamin D can contribute to loss of leg strength as we age, and what role eggs can play in maintaining muscle. Imagine a short clip where an older person struggles to climb a step, then gains confidence after a simple dietary change combined with a strength plan. If you care about strength in your legs, hit the notification bell because that video will have practical exercises and 3 egg-centered meals to support muscle and balance. To conclude, let me recap simply. Eggs are a nutrient-dense, versatile food that can be part of a healthy diet when prepared and stored correctly. Avoid undercooked eggs in vulnerable people. Do not reuse rancid oils. Do not discard yolks reflexively, and pair eggs with fiber and healthy fats for best results. My experience with patients like Maria, John, Lucy, Emma, Mark, and conversations with experts like Dr. Lee and Sophia inform these recommendations, and the science supports them. If this video helped you, subscribe for regular episodes where I translate research into simple daily actions. Share this with someone who needs a practical, safe approach to eggs. Remember, a small change in how you cook can transform a meal into a healthier habit. Eating well is an act of care you give yourself every day.